Hi there, everyone. Ben Chappell here. Going to give you the week 5 discussion presentation on my telemedicine technology. Um, so a brief overview, it's the CU Docs Telehealth program. CU is University of Colorado Medicine, that's where I work. So this is a remote monitoring program for monitoring of patients in their homes with devices, chronically ill patients, probably starting with diabetics and hypertensives, possibly moving it beyond that at some point. We also want to have a live video telemedicine aspect for face-to-face encounters for care management. We have health coaches, pharmacists for medication management, licensed clinical social workers for behavioral health management and social determinants of health. So our major technology needs here are the live video encounters. We need a platform or a method for that, and the remote monitoring devices themselves, and then the platform to collect the remote monitoring data and interface it with our EHR. So for our program, for the live video encounters, so we currently use Epic as our electronic health record, our EHR. We see no reason to move outside of Epic because we have this functionality open to us currently through Epic. So there is telemedicine functionality currently. Patients sign up through what's called MyChart. It's basically the patient portal that they have access to their records and their information, and they can schedule appointments and send messages to providers. So they can have access to this on their mobile devices, their phones, their tablets, their computers. So we can employ this functionality to do live video encounters. Patients can initiate these or schedule them from the MyChart app, and providers can schedule and initiate these also from within Epic. For remote monitoring devices, we've decided to partner with a third-party vendor named Validic and use their Validic mobile platform. So essentially, there wouldn't really be any purchasing of specific monitoring devices. This would integrate more or less seamlessly with existing patient devices or any devices that they would like to pursue in the future. So, if a patient sitting at home already has a blood pressure monitor, has a glucometer for doing blood glucose, things like this, scales, anything, any sort of remote monitoring device, they can continue to use those ones. So the platform admittedly works best with Bluetooth enabled devices. So many of the newer ones, particularly on the market, are Bluetooth enabled so that you can upload your information directly to an app within your phone or laptop, something like that. However, the Validic mobile platform also has technology kind of like how you have at your bank where you can take a picture of a check to deposit it. And it'll take a picture and it'll fill in certain fields, and you might have to, adjust things a little bit, but then you can just simply deposit it without going to the bank or even going to an ATM. So Validic Mobile has this capability where if a patient has an existing device that is not Bluetooth enabled, basically a locked-in device, they can still do their readings, and as long as there's some sort of display output where they can view their readings, as you see here in the picture, then they can take a picture of it with the Validic mobile app and have it be populated into the Validic mobile data collection system. But for most of them, they can simply use a Bluetooth enabled device, and this is pretty much all Bluetooth enabled devices, no real restrictions on this, to sync up to the Validic mobile app, use their devices as they normally would, and then that data will be uploaded to the Validic app where they can see it, and it will be sent then onto the Validic data collection interface So that will be our plan for data collection, and the EHR interface is also Validic. They have a platform called Impact or Inform, and that would be where that data from those remote monitoring devices is collected, normalized, aggregated, and then it can be interfaced with our Epic EHR to be populated into discrete data fields for patient-generated data within Epic using HL7 interfaces. So it's a complete circle. They're kind of self-contained, and patients do not have to be provided with specific devices, and they do not have to go out and buy specific devices even. Even if they have an old blood pressure monitor, no Bluetooth enablement, nothing like that, they can still partake in the program. We selected this particular technology platform because other options, while they were more comprehensive, they kind of intruded on that sort of patient-centeredness, patient choice, and really they were proprietary devices that patients would either have to purchase themselves or the healthcare entity, CU Docs, would have to purchase on their behalf, set them up with those. Instead, we really like the idea of patients being able to use their own devices, bringing those to the table and having a platform to collect that data seamlessly and integrate it with the EHR. The Validic platform does incur some costs, but it is much lower than, say, a comprehensive platform where it would be these proprietary devices collected on a platform and integrated into the EHR separately. So we did like this. The other sort of bare bones option was to keep that patient choice in place, let patients have whatever devices they're currently using to monitor their biometric markers outside of the office, but to basically have them manually input this information into the Epic MyChart, which, you know, that's doable. That's certainly a possibility. It's a very low cost possibility because we already have Epic going. We wouldn't have to get devices. It's really just, say, a bring your own device sort of situation. Patients would manually enter that data. In the end, though, we decided that the data reliability and validity concerns of such an option were a bit too much to swallow, just because there's a lot of error that can happen when you're doing a lot of manually entering things here and there. With the Validic platform, even though patients can use their old non-Bluetooth enabled devices, there's a certain, you know, a slight push to get maybe newer Bluetooth enabled devices if they don't already have them, which can be more reliable in their data capture and transfer. All right, thanks so much. Bye.